All right, we're here with Angelina, and Angelina is about to start her treatment with Dr. Davis. So could you please tell me how long you've been having this problem?
The knee pain started at the end of January after I fell on a curb.
Oh, no.
And it popped up. I've had it drained of fluid twice.
So they drained it twice?
Yes.
Yes. Did they tell you anything else about?
They did. They said that it was bone-on-bone osteoarthritis, and I required knee replacement surgery.
Wow, knee replacement surgery. Holy cow. All right, I'm going to have you do a couple different exercises, and I know you and I discussed your pain right now. And from 0 to 10, what is your pain level?
About a 6.
And is that like an average throughout
Chronic.
the last couple of days? Okay, so if you're at a 6, all right, so the first thing I'm going to have you do, Angelina, is I just want you to stand up. You're going from a sitting position to a standing position. And where did you feel that?
A little stiffness behind the knee.
In the back of the knee. Okay. All right. Okay, so the next thing I'm going to have Angelina do is I want you to put your feet shoulder length apart, arms straight out in front of you, keeping your heels on the ground. I'm going to have you squat down as far as you can and do it nice and slow. And slowly come back up. And where were you feeling that?
That's all around. That's a wraparound.
The whole way around. Okay. All right. Perfect. So the next thing I'm going to have you do is go up and down the stairs. Okay. So how were the stairs for you?
Easier going up than coming down.
Okay. And where were you feeling the pain there?
The pain is at the top of the knee and the side of the knee when I
Okay.
go down.
Perfect. All right. Let's get started. Are you ready?
I'm ready.
All right, so remember, press down, ready? Keep your leg, yeah, press down on her hand. Hold her
With your
hand.
heel. Okay.
Like you're moving leg down.
Oh, push down.
Push down,
Okay.
push down.
Push
One,
harder. Push harder.
2,
Harder, harder, harder.
3, 4, 5, 6, 7, and bring it back. Keep it
Whoa,
straight.
that's good.
Ready? Press, 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 press. 1, 2, 3, 4, 5, 6, 7, and relax. And you'll keep it straight. There we go.
Try it. I'm trying.
Very good.
One foot kind of bounce back there.
Press down. Press 1, 2, 3, 4, 5, 6, 7, and bring it back. All right, now just relax. You don't have to press.
That's a tough part right here.
Right. So Nina just finished her treatment with Dr. Davis. How you feel?
Pretty good.
Awesome. All right. So let's have you do the movements again. Step forward. Let's do the squats.
Okay.
Great. Come up. How was that?
Good.
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 Awesome. Let's
Stairs?
down the stairs and up the stairs. Yep.
Better than it was.
Good. Good to hear. Look at that. Running up and down. How was that?
Good.
Amazing. So you were saying you were a 6 before. How do you feel right now?
I'd say probably a 2 or a 3.
Oh, great.
So it's
So
cut in half.
awesome. Awesome. I love it. So you consider it to be a positive result. You want to continue with the doctor's recommendation?
Absolutely.
Awesome. Let's do it.